Prior to beginning the scrub, put on the protective attire, the scrub suit, cap, and the mask. First, open the sterile gowns and gloves. Remove the outer wrap from the sterile gloves and leave the gloves in the inner sterile wrap on the sterile field. For the performance of hand washing, first is turn on the water and adjust the flow so that the water is warm. Next is assess the hands. Nails should be kept short and should be free of any form of nail treatments or nail polish. Check the hands for breaks in the skin such as hangnails or cuts. Next is remove all jewelries. Wet the hands thoroughly by holding them under running water, letting it run from the fingertips to the elbows. Apply 2 to 4 ml or 1 teaspoon of liquid soap to the hands, but hold hands higher than the elbows during this hand wash. Thoroughly wash and rinse the hands. Continue this motion for at least 15 seconds. Wash hands using friction on all surfaces. Rub palms together, hand over hand, finger interlaced, washing between the fingers. Wash and rub fingertips against the palm of the opposite hand and vice versa. Wash fingertips and nails individually. Wash thumbs and wrists. Wash beneath weather rings if worn, and then rinse hands tolerably by letting the water run from fingertips to elbows until the cleaning agent or liquid soap is removed. Next is ready or open the scrub brush or obtain brush from the dispenser. Obtain nail cleaner with hands. Clean beneath and around each fingernail with a nail file or orange stick under running water. After doing that, drop the nail cleaner in the sink when complete. Place all fingers of one hand together, example the left hand, and brush across nail tips for 30 strokes. Next is mentally divide each finger and thumb into 4 planes or sides and scrub each plane or side separately for 5 strokes, for a total of 20 strokes for each finger. Scrub the palm of each hand for 20 strokes using a circular motion. Scrub the back of each hand for 20 strokes using a circular motion. Using the same brush, scrub the other hand using the same technique as described. After scrubbing of both hands, next is we scrub the arm. Scrub the first one arm as follows. Mentally divide one arm from wrist down to 2 inches from the elbow into 2 or 3 sections or segments. Further divide each section or segment of one arm into 4 planes or sides. Begin with the section or segment nearest your hands. Scrub each plane or side with 5 strokes using a circular motion. Using the same brush, scrub the other arm using the same technique as described above. After which, discard or drop the brush in the sink. Next is rinse both hands and arms as follows. Flex your arm and rinse from the fingertips to the elbow in a single smooth motion, allowing water to drip from elbows. Do not move arm back and forth under the water. Avoid splashing water or lather onto the surface of the scrub suit or gown. Always keep hand higher than elbow to prevent water from running back from a non-scrubbed area to a scrubbed area. Release water control and allow the water to drip from elbows for a few seconds before moving away from the scrubbing area. Next is go to the sterile setup area and dry hands. Walk backward into the operating room while keeping your hands elevated at waist level, with the elbows flexed in front of you but away from your body. Walk to the table containing an unwrapped sterile towel while keeping a slight distance from it. Pick up the sterile towel by its folded edge without dripping water into the sterile field. Allow the towel to unfold without touching anything. Use one hand of the towel to dry one hand completely using a rotating motion and moving from fingers to elbow. Use the other end of the towel to dry the other hand and forearm in that order. Drop the towel into the designated receptacle. After performing scrubbing of hands and arms, now we're going to put on the sterile gown. Pick up and unfold the gown. Identify the inner surface of the gown and pick up the gown beneath the neckband. Avoid touching the sterile field or the outer surface of the gown. Move away from the table, holding the gown away from the body at arm's length. Allow the gown to unfold from the top down. Do not let the gown touch the floor and avoid dangling the gown against unsterile surfaces. Have a co-worker grasp the neckties without touching the outside of the gown and pull the gown upward to cover the neckline of your uniform in front and back. The person tying the gown should take care to touch only the ties and not the front or sides of the gown. Now we're going to put on the gloves. Open the sterile wrapper containing the sterile gloves. With hands covered by the sterile gown cuffs, open the inner sterile glove package. Then put the glove on the dominant hand. With the dominant hand, pick up the opposite glove with the thumb and index finger, handling it through the sleeve. Lay the glove on the opposite gown cuff, thumb side down, with the glove opening pointed toward the fingers. Use the non-dominant hand to grasp the cuff of the glove through the gown cuff and firmly anchor it. With the dominant hand working through its sleeve, grasp the upper side of the glove's cuff and stretch it over the cuff of the gown. Pull the sleeve up to draw the cuff over the wrist as you extend or push the fingers of the non-dominant hand into the glove's fingers. Next is put the glove on the dominant hand. Place the fingers of the gloved hand under the cuff of the remaining glove. Place the glove over the cuff of the second sleeve. Extend the fingers into the glove as you pull the glove up over the cuff. Then adjust gloves for fit and comfort while maintaining sterility. When worn, sterile gowns should be considered sterile in front from the waist to the shoulder. The sleeves should be considered sterile from 2 inches above the elbow to the cuff. Have a co-worker hold the waist tie of your gown using sterile gloves or a sterile forceps or drape. Make a 3/4 turn, then take the tie and secure it in front of the gown. Or have a co-worker take the 2 ties at each side of the gown and tie them at the back of the gown, making sure that your uniform is completely covered.